Dr. M.B. Phillips' new video, he is telling that no parent should send their children to courses other than modern medicine, like Ayurveda, homeopathy, Siddha, etc. Specifically referring to Ayurveda, BAMS he is calling as BAMS.
Plus, he needs to learn how to pronounce BAMS.
So
It's not MBS. No.
Yeah.
MBBS is MBBS.
yeah, when we call it
should not be-
MBS,
It should
how
not
it
be
will
BAMS.
be. So, Mr. A.B. Philip, for his understanding, we are doing this video. Don't think like that. It is not for his understanding or his correction that we are presenting this video. We are presenting this video for the clarity of audience who are receptive to the science of Ayurveda, to the nature of science of Ayurveda, and regarding the scientificity and potential of Ayurveda. In the present scenario, it is a necessity to do this. So, but based on his video, only we will have to start.
Yeah.
As he is the person who is constantly defaming and distorting Ayurvedic science. So, his first point is regarding this varicose veins. Some Ayurveda hospital is treating varicose veins with bloodletting, Siraveda procedure. So, what he says is correct.
Yeah.
Without
He is
understanding the
exemplifying
pathology,
that.
without understanding the pathology that it is because of weakened vessel wall and dysfunction of the walls
Right.
that it is happening, torches,
Yeah.
and it is happening. But without understanding anything, Ayurveda doctors are doing bloodletting procedure. But A.B. Philip doesn't know that it is because of the problem in conventional Ayurveda practice and not because of the science of Ayurveda. It's not the problem of the system.
Somebody does
It
in
is
a
a
wrong
problem
way.
of the person. So the thing is that we don't have clinical audit. This is something very important, and I have been speaking on this in my many videos, and we have given proposals also to ministry stating that our existing curriculum and mode of training is very substandard, and we don't have clinical audit to ensure standardized quality clinical decision making. So because of these improper clinical decisions,
He got a wrong picture.
he got a wrong picture. But he is considering it as the failure of Ayurvedic science that
And
such decisions are
He
emerged.
claims himself as an expert by saying that he has read so many books.
Yeah, he's
related
showing
to Ayurvedic
picture in the
science.
background.
Yeah.
Charaka Susruta and cover to cover read. What do you mean by cover to cover read? Do you think BAMS can be, the whole Samhitas can be learned cover to cover in a fraction of a second? What do you mean by saying that you have read cover to cover? It is not a story, it's a science. So I think he wants to ridicule himself by telling that he read cover to cover. Any sensible person will understand that from that one sentence itself, it conveys the reality about what he understood about Ayurvedic science. So cover to cover reading, he understood that blood vitiated. He is demarcating oxygenated and deoxygenated blood with the picture of Pitta Dushta Rekta explained in Rekta Pitta, that Pitta, blood vitiated with Pitta, he is interpreting as deoxygenated blood, venous blood, and the original, oxygenated blood as the other one, pure Rekta.
So it's just from that meanings he is telling all this.
Literary meaning he is taking.
Oxygenated blood, deoxygenated blood. It is not like that. It is totally wrong. It's no way similar to what he is saying. So Shuddha Rakta, Ashuddha Rakta, all these are scientific terms. It's not like oxygenated blood, deoxygenated blood. That is
Arterial and venous.
Yeah.
He is misinterpreting.
Yeah.
Shuddha Rakta as arterial and Ashuddha Rakta as venous blood.
All these are
The
technical
complete-
terms, and his understanding is very poor.
So that is why he is telling like that. Pitta Dushta Rakta is not deoxygenated blood or venous blood like how you think. It's because of imperfect, totally flawed comprehension and your intention, your evil intention behind to
This is
distort a
best
medical
example
science.
for a scholarly science being adjudicated by an illiterate.
Yeah.
Illiterate in the sense he doesn't know Sanskrit, he doesn't know the meanings of Sanskrit, he doesn't know what the Shastra is,
Scientific meaning.
scientific meanings of Ayurvedic science. He doesn't know anything. So that
He
is
wants
but
to
scholarly science.
Right.
That how much hard work, how much learning is required. For that, he is saying that he has read the whole thing, that English meaning written by somebody, which is in the reference book of syllabus. So he is saying that he has read and learned the whole science, and he is criticizing. So he is making fool of himself.
That's what I'm telling. He's interpreting animal urine is being. We have a specific science of urine, like all the, not only urine, all the animal products and plant products are interpreted. Even food materials, each and every food material is interpreted for its. There are basic and applied research done in Ayurvedic science. It's not all about application of this medicine in that disease. Ayurveda has done extensive basic research regarding the human being and all the things which are interacting with human being. So
yeah, what all are being practiced by the humans, all these are explained. Ayushyani cha anayushyani dravya guna karmani vedet yadu ayurveda. All the ayushyani which are favorable for wholesome for life, which are unwholesome for life, and all the objects with its guna karma,
biological functions,
functional aspects, and as well as what all effects it will be producing in the body, is very well explained. So this is that much precise science.
So in accordance to the variables,
according to that, when something is written, when meat of lion is mentioned, that doesn't mean that everybody should eat lion's meat. Or when madhya is or liquor is mentioned, so that doesn't mean that Ayurveda asks everybody to drink alcohol. So he is making fool of himself.
So there are many medicines which are prepared with gomutra, bastimutra, goat's urine, etc. What is there in it? In modern medicine also pre-marine. What is this pre-marine? Which is a substitute for hormone replacement therapy. It is an extracted from pregnant mare's urine. That's why it's called pre-marine. What about heparin? It is derived from pig intestine. Insulin from the pancreas of pork or beef. Gelatin capsule, collagen of cow and pig. So there are many drugs. Even MMR vaccine, it contains certain ingredients from pig. So what is there? We can also say this in return. What is there? Once it is used as a medicine in a formulation, the properties are of that medicine. Nobody is drinking cow urine or goat urine or horse urine as such. It is used as an ingredient in certain medicines. When it becomes a medicine, the action is not that of urine alone. It is a medicine. It has got a synergistic effect of many
mentioned in the science doesn't mean that it should be taken by all. There are so many tattvas, so
dynamics
many principles.
And kinetics, pharmacodynamics and kinetics, detailed principles of pharmacodynamics and kinetics are explained in the science of Ayurveda. It's not like any patient comes, cow's urine is administered. There's lot of confusion between traditional practice and Ayurvedic scientific practice.
Yeah.
Many traditional herbal healers are using Ayurveda medicines. They are administering urine therapy and many other such things which are misinterpreted as Ayurveda. Ayurveda is science-based medicine. Ayurveda is not tradition, culture, belief, heritage. It has got its own innate, deep, vast scientific infrastructure explaining how and why, what, when, where, how to apply, how to understand a condition, how to understand multiple conditions in a complex, dynamic human being. Everything is explained in Ayurveda. So it is like, this is a very silly and stupid way of interpreting things. And he is telling managing obstructed labor. In Ayurveda, there is a procedure explained for management of obstructed labor. So there are many things explained in the science in accordance
and procedures are mentioned.
In accordance to that age availability of materials, how they were managing. What does it mean? Indicate? It indicates that they were successfully managing obstructed labor with these techniques. Finally, what is the outcome? Obstructed labor was getting managed by these techniques, and all the techniques are substantiated by scientific principles. If buttocks are asked to be squeezed, or what is the purpose of doing that is well explained. Now when we start criticizing vacuum labor, when we start criticizing many things which are being done today, where does it end?
Yeah,
Cesarean,
which were feasible at that period.
what was feasible during
all
that.
those are mentioned. So you need not do everything as such.
As such, it is.
You can apply your intelligence.
So-
Whatever is feasible in the present period, you can do. You can modify.
According, we can incorporate technological aids in labor. In Ayurveda also, these can be incorporated.
Yatha kurvanti sa upayah. So the method can be whatever which is available or feasible in
Every period, it can be used.
It can be used.
But the principles remain the same. Underlying
Ayurveda
principles do
treats
not
with
change.
principles. Karya tattva visheshajnah.
Pratipatto na mukhyadi amudha balam apnodi yadamoha nimittajam. So we are treating not with these techniques, Mr. Ebi Philip. We are treating by science. If you choose many techniques and explain one after another, it doesn't make any sense. Whatever things you have explained in your interview, we are not doing anything of that in contemporary practice. Science-based, evidence-based
We are
Ayurveda.
treating with principles. Jnana buddhi pradipena yona avishyati tattvavit. So we are diagnosing with principles, we are treating with principles, and with yukti. It's scientific wisdom. We are
Shastra Sahita Tarka.
we are applying the principles.
Reasoning
and
led
it's
by
not
science.
with just medicines or with methods.
He
or
thinks
procedures.
that Ayurveda is like MBBS Sims textbook.
Yeah.
Like this formulations in this. They have a Sims textbook.
Yeah.
They are adopting medicine.
They are prescribing
and
drugs only.
Drugs in this
Yeah.
drug in that
So
disease.
drug prescriber is criticizing an Ayurvedic science which reverses cause mechanisms. Drug
Right.
prescriber can never reverse a cause mechanism, and he is more inclined to certain means portions related with ladies or portion which has some sexual contents. So he is more attracted or more inclined towards that.
He is having more interest
He
in
is
reading
having-
such.
I don't know why.
And he is distorting in his own ways.
And
Maybe to attract
this much huge
audience.
samhitas are written, but he is only inclined to those portions.
That's
Why
why.
it's like that?
There are definite
Drug
reasons.
prescriber, Mr. Ebi Philip. Why it is like that?
So his intentions are this only. He wants to distort a real science. After birth of baby, protection from infection, chanting mantra and rakshogna kriyas. Chanting mantra, there are many things which are explained how to protect the baby from infections. Mr. Ebi Philip is not seeing all that. Finally, he is emphasizing upon rakshogna mantras and dubana, medicated fumigation. Medicated fumigation, antiseptic liquids are being used for wiping floor now. What is the guarantee that there is antiseptic liquids used? What are they? They are made of chemicals for wiping floors in hospitals. Everywhere it is being used. And what is even perfumed rooms?
Yeah.
Now perfumed rooms are there to improve the scent of the rooms. Chemicals are being used. Fumigation is a medicinal technique. Medicinal fumigation is not done with baby inside the room. First, medicated fumigation is done in that room, and then thereafter baby is being brought there. It has got its own germicidal properties, all these dravyas, which are
Not
all
only
these.
germicidal, so many other properties which cannot be explained like this.
It is like chanting mantras. There may be so many atheists who do not believe in mantras and God. That doesn't mean that some people do not believe. Doesn't mean that mantras are just waste of time and waste of things. It is not like that. Mantras have got their own innate power and scientificity which are being studied all over the world deeply. So you cannot criticize mantras or Vishnu Sahasranama is being explained as a technique.
Yeah.
Adravya, non-medicinal technique in fever. It doesn't mean that fever is treated with Vishnu Sahasranama, Mr. Ebi Philip. So this Rakshogna Kriyas are very important and they are being adopted now also. And he says that TB, red meat is advised without patient realizing that it
TB
is
he
meat.
correlated with Raja
He is
So
correlating.
Raja Ekshma is not TB.
I don't know who told him about this.
Means in that text it might be written, but it is not correct because a Sanskrit person or somebody might have helped him and he just translated that into English or that technical term he might have used, but Raja Ekshma is not TB.
So,
And there are instructions, there are advices to take meat, and it's not a gopya thing, or it's not to be revealed, or it should not be revealed to the patient. It's not like that. Mamsameva asnado marbigam pibato anu avatharida vegasya na lapade andaram. So ekshma na lapade andaram. So those who are practicing meat as well as taking Dibana medicines, it doesn't mean that you need to take alcohol itself. So Dravya Samyoga Samskare Adhigo Guna is Arishta. So there are medicated stuff are there with which Srodo Vibanta Mokshartham Bela Oja
to clear the channels
to clear the channels as well as to impart Bela and Ojas. So this is done. So the objective is important. So it is mentioned that Ajnada Shastra Satpavan, just reading the text and understanding the meaning will not help
literary
in any way.
meaning.
Literary meaning is of no use.
It's like very much
When you are learning a science, it has to be learned in its manner itself.
silly and stupid also.
Yeah.
And this meat, vegetarianism.
He is confidently defaming Ayurveda.
Ayurveda doesn't advocate vegetarianism. Ayurveda is science of human being. Everything, it is meant for vegetarians,
those who are not taking,
non-vegetarians, everyone.
Those who are not taking meat, another methods are mentioned.
Methods are mentioned. It is
Sarvathanya Krita Yusha is mentioned.
Ah.
So many methods are mentioned. Those who are not taking alcohol, Amla Dravyas are mentioned for the Ipana or for the objective.
So it is not like vegetarianism is promoted or...
There are no hard and fast rules that you should take this medicine. So, Sada Dosha Ushatadini Vikshya Dwadasha Tatvadaha Kurya Chikilsidam Pratyo Na Yoge Reva Kevalam. It is not a recipe which is treating the patient. We are assessing in so many ways. We are determining the treatment principle. We are applying the yukti, scientific wisdom, to determine what medicine is to be chosen, how to apply that, what all food is to be, or diet and regimen
Scientific nutrition.
and discipline is to be made in the patient, and finally how to apply that. All these are determined, whether it is to be treated with some external procedures or not. So many things are there. It is not like if it is mentioned in the text, you have to give this one itself.
That's what I told. He is comparing with his Sims textbook.
And he is confidently telling that this is a fraud and
Deceit.
Deceit and fraud. So
No. Dr. Abby Philip is ridiculing himself by such kind of words and applications in your lecture.
law of this land is drug prescribers are to be called as doctors, and Ayurvedic physicians he will call only Vaidyas.
So actually here you should understand, Mr. Abby Philip, that Rajeshma is not tuberculosis. Tuberculosis, there is scientific treatment in SBEBA, science-based, evidence-based Ayurveda has got protocols. It is Ayurvedic science-oriented, updated, revised protocols based on the principles of Ayurvedic science only. Don't consider SBEBA as something outside this Charaga, Susruta, etc. It is an updated scientific version of Ayurvedic science only. Okay, so don't remember this always. TB is not Rajeshma. And to enhance male libido, he's telling men should consume variety of animal testicles. He has got some references from some Samhita, end of Samhitas, and it is not like that.
That's what he is inclined to some such things.
Such things only is seeing.
He is seeing. This much big Samhitas are there, but he is seeing only this. We have never treated like this. We have never heard of this.
I am hearing this for the first time. To improve, to enhance male libido, there are scientific methods to understand why it is happening, cause mechanisms in that particular individual. There are methodologies in SBEBA to explore the cause mechanisms behind. Would you please talk on that? Because you are handling male fertility issues.
He was also mentioning about Upadamsha.
Yeah, Upadamsha also he was making fun of.
The causes mentioned in respective chapters are not cause of that disease. It just produces susceptibility only. So susceptibility means some structural damage or structural susceptibility for that disease. all the cause of disease is mentioned in Sarvaroga Nidana. You might not have seen.
So Mr.
but-
Rabbi Philip must read
So
it.
Roga Nidana means the cause of the disease is mentioned in. So it is not like sexually transmitted diseases are developing by the causes mentioned by Mr. Rabbi Philip. It is
Ubadamsha.
mentioned in Sarvaroga Nidana. Also regarding common cold, he was mentioning
that I am
Stri
coming
Prasanga.
to. Yeah.
So engaging
Pradishyaya
in,
Nidana.
engaging in intercourse. So sexual intercourse continuously can result in
Immune.
resistance and immunity decline. That can result in development of infections. So it doesn't mean that always this is the cause, and causation is explained with Sarvaroga Nidana. So you need to understand the science, how it is explained. So it is not like taking a literary meaning of some sloka and according to you are misinterpreting and saying that this is the cause and this is foolishness and this makes no sense and this is a fraud science.
So this aphrodisiac properties itself, depending on that person's condition and the cause mechanisms, it is being designed, right? Protocol.
Yeah.
What is exactly reducing the count or motility or interest in the sexual activity? Everything has its own cause mechanisms. There are algorithms.
We have principles with which we can diagnose.
Diagnostic principles are there.
And treatment principles
Yeah,
are also
based
there.
on which nobody will give this
Logics
kind
to
of,
apply also.
nobody will give animal testicles and other things like this. I don't know where you're choosing all this. If
He
they
is,
are
he will get attracted to these things only.
these things only, that's what.
How
And
it is possible?
diabetes, we are treating many hundreds of cases of diabetes.
We are
For
reversing
him,
also.
we are reversing a lot many cases of diabetes.
But he got a yoga.
Elephant
a formulation.
excreta with honey water after feeding elephants with millets. And this is explained in Ayurvedic science somewhere in some page of some Samhita. Doesn't mean that it is the treatment for diabetes in Ayurveda, Mr. Abhi Philip. Ayurveda has got diagnostic and treatment principles. They are the main tools for Ayurvedic diagnosis and treatment. That you should understand this. Otherwise, you are going to be people will laugh at you, Mr. Abhi Philip. If you tell nonsense like this as Ayurveda continuously, maybe your team will appreciate you, but anyone with senses, they will care to understand the truth and they will laugh at you, Mr. Abhi Philip. It's not by elephant's dung or something that diabetes is getting treated. We are treating type 2 diabetes in Ayurveda based on the two
We are
phases.
reversing the cause mechanism also. And
By
many are without-
improving an insulin sensitivity, stimulating metabolism, improving insulin sensitivity and stabilizing metabolism, after which they don't require any treatment further. Every month, 1 week, they will undergo scientific nutrition schedule to stabilize metabolism for a few months, after which they don't require any treatment at all. There are lots and lots of cases, Mr. Abhi Philip, who diabetes is being reversed. Once being treated by people in modern medicine with lots of drugs and insulin, they are getting reversed, Mr. Abhi Philip, without the need of any medicine. I'm not talking about diabetes alone, but here, as you have mentioned, dung for diabetes, I think it's a need of the hour
throughout
to
one's life, one has to take drugs to suppress that condition, and they will be cheating the patient that your blood sugar is under control. It is not under control, it is suppressed. It is inhibiting various mechanisms. It is not addressing the cause mechanism. Then also, he is very much enthusiastic to criticize Ayurvedic science.
Anti-diabetic drug, if improving insulin sensitivity, why they are not able to bring it down and enable the patient to reach a state where they require no more drugs? Why it is not possible to do that? If you claim that your drugs are improving insulin sensitivity and working against this so-called insulin resistance, why
And
it
they are
is-
developing complications also.
they are developing lots of complications, and also one drug is causing many complications. Even treatment is causing complication. Disease is also causing complications. Why it is happening so? I'm not talking about diabetes alone. Here, the context, you have told that diabetes is treated with elephant dung. No. Maybe you know some person You bring that person also and do a video asking him the reason. He will explain to you. But that is not Ayurvedic diagnosis or treatment. Purusha, according to him, he is telling that females are degraded. And Purusha, I think that's a misunderstanding.
Purusham in Ayurvedic science is a technical term. Purishete. Purishete means all living human beings are considered with Purusha. Purusham Vikshya. So it's not like Purusha and Stri, which is written in front of washrooms. It is Purusha is written, that
human
means man, and Stri is female. It is not like that. So Purusham here it is males. When this Vajikarana Adhyaya, which is meant for improving the act of sexual activities, so increasing the strength or speed and other things, when it is mentioned, so it is more regarding men, that is explained. So that doesn't mean that females are degraded, or so all female disorders management are explained,
in a separate.
and all are considered equally.
It is mentioned in a separate
So
context.
he wanted to make some feminist
misinterpretation, and he wants to attract audience. That is the only thing. So one another thing, Mr. Abby Philip, microbiome transplant. What is your opinion on that? You are extracting microbiome from the stool of healthy people and transferring into the colon of autistic children, and you claim to say that their behavior is improving. I'm seeing lots of parents telling lakhs of rupees are being charged for this. Can you imagine that microbiome being extracted from stool of the person, and he's making fun of animal urine. So this is their treatment, extracting microbes from the stool of a healthy person and transferring it to the gut of autistic children and claiming that behavior is getting improved. I'm seeing lots of parents who have spent lots of money and still in misery. Their children have become very extremely bad after that, and on many chemical drugs also, and behavior worsening day by day. That's why they are coming to this system for any help. So this is what is happening. Before, like he was making fun of this urine, animal urine. So I suddenly remembered this. Infectious diseases, Krimi. He has got Bhuda. Krimi is considered as Bhuda. So as
Krimi and Bhuda, everything is different. So Krimi, some procedures are mentioned, and he was explaining that. So procedures, medicine, so many things are mentioned, which were feasible at that period was mentioned. So everything works on treatment principle. It's not like procedure or this medicine for this disease. So treatment principle, according to the most apt medicine will be chosen, and the treatment will be like that. It's not like what he got knowledge from where we don't know. But
infectious diseases, he thinks that we are treating based on, means we don't have much idea.
He was explaining about Vishamajwara.
Past lives deeds have caused infections. Like that it is written in the Ayurvedic science. He doesn't know infection. He doesn't know about what is written in Ayurvedic science, but he is misinterpreting things. Infections are very successfully, effectively, scientifically treated in SBBA, Mr. Abby Philip. We are treating all kinds of infection with diagnostic and treatment principles. In modern age, all infective fevers, all kinds of infections in a predictable manner. Every kind of infection, the nature of the disease is studied with deeply by using Ayurvedic scientific principles, and there are very strict algorithms to understand it, how to treat dengue fever, how to treat typhoid, malaria, all kinds of. Flu is considered as a disaster by modern medicine. No, flu is not a disaster.
They are also fumigating.
You are also doing fumigation, wearing mask and wearing a dress, whole body covered, and not. We were not using all that, Mr. Abby Philip. I was attending patients with infectious fevers. Many cases during that period, I didn't have any sort of anti-hand wash or anything with me. We both were attending cases. Infective fevers are treated with host factor modification. Immune system is being focused upon. all these virus, bacteria, etc. are primitive age science. So as science advances, we should be caring to understand the facts. Virus, bacteria, etc. are pre-Vedic period.
We are not at all concerned with bacteria, virus or fungus.
So it is the immune system and immune system alone that determines the period of recovery, chance of recovery, and how efficiently we can tone up immune system to complete, to eradicate or eliminate the whatever be the adverse agent in tissue or circulation. This is possible still less than 5 days or 3 days even the person is out of symptoms, getting out of symptoms and infection which can be confirmed clinically and with objective parameters, lab investigation. So don't think that infections are getting treated in a very pathetic phase like how you have explained. That is not the fact. Swelling of eye is treated with eyeliner made of camel bone. Maybe some places it is explained, but swelling of eye has to be scientifically explored with diagnostic principles
and
of inflammation of the eye, whether it be inflammation. We are having diagnostic principles to understand infection, inflammation, autoimmunity, hypersensitivity, hypertension, hormonal dysfunction, all the things which are prevalent in society today. There are scientific principles in science-based, evidence-based Ayurveda which are published, which are being repeated by hundreds of doctors all over India, and also transparent and reproducible. Logics, what is meant to be reproduced in a medical science, the logics are meant to be reproduced. What you have understood in that situation, which principle you have applied from your science to understand the situation, to standardize the clinical diagnosis, to standardize the treatment. It is not available in data emerging from population. You must be able to understand the patient-oriented environment with standardized parameters, which are explained as tools for diagnosis, differential diagnosis and treatment in Ayurvedic science, which is being developed and established in SBBA. So he tells that, and also Vishamajwara, he is telling that patient has to be frightened and frightened by robbers.
All states of fever. Fever is a disease in Ayurvedic
For him
science.
it is a symptom.
Because it is having a definite pathology. The cause varies, but that mechanism will be the same. So based on that mechanism, which all tissues are affected, which all immune mechanisms are taking place, according to that, it is given the nomenclature Jwara. It is not fever, it is Jwara. So Jwara is having a specific cause also. So all the states and stages possible in a fever or in Jwara condition is explained in that context. In that, Vishamajwara is another condition which may develop in convalescent period or immune compromised people, or when their immune status is less. So they develop intermittent fever. So when one psychiatric complaint also supervenes that. So the treatment principle in that status is mentioned as a shock therapy.
So that reference pertains to that psychiatric complaint.
Psychiatric complaint when supervenes. So shock therapy is given in Western medical system also, and this is by faking. It's not by bringing a real thief or a real elephant, or it is by faking. So
some sort of shock has to be given to the patient.
So and this is a method. It's a adravya method. It's also called upaya.
So that doesn't mean
that also has scientific basis.
Yeah.
It is not like some primitive methods are adopted in Ayurvedic science.
It's not like that. And bloodletting therapy and all not required these days. There is no need to do all this bloodletting therapy and inducing emesis, inducing purgation. These are all Panchashodhana procedures, very scientific procedures. Not because they are primitive, I am telling they are not required in the present age. They are deeply scientific, but the thing is that present day nature of diseases do not demand any of these procedures. That is what I meant regarding inflammatory, immune mediated, and also cancers.
And he was demeaning like Krishna is thirst. That is a blunder. Krishna is not thirst. So mukha shosho jala atraptur anna dvesha. So there are so many symptoms. Saumya thadu prashoshanat. Saumya thadu means when dehydration happens, it is called trishna. It is not like thirst. Feeling of thirst is a disease, and for that vamana is indicated. So there are so many causes, and causation is specifically mentioned in Ayurvedic science. In one condition, there the treatment principle mentioned is, but for that so many cause symptoms should be available. Then only that treatment procedure will be done. It's not like it is mentioned in science, so we'll be doing
everything as such.
emesis and
Like Sims textbook. Paracetamol in fever.
Is
No analysis required. Just give paracetamol.
means he cannot imagine anything beyond that, like their drugs.
So the thing is that Mr. Abby Philip, you are telling we are not doctors. You are, actually the definition for doctor in Ayurveda is Bishak. Tadhaiva yuktam vaishajyam yad arogyaya kalpade sajaiva bishajam shreshto rogebhyo ya pramojet. Who is called as a doctor? Doctor means scientific practitioner, Bishak. Bishak is the technical term for doctor in Ayurveda, Mr. Abby Philip. So who is a doctor? A doctor or Bishak is the one. Sachaiva rogebhyo ya pramojet. One who is releasing or one who is attempting scientifically to take the patient out of disease or cure the disease. One who is attempting to cure the disease. He deserves to be called as Bishak. For us, it is Bishak. Bishak means scientific physician of Ayurveda. Others, they have told us Taskara Vrteha. Robber physicians. They are not called as Bishak. They are robber physicians.
Doing business
So
with the patients.
people who are not attempting to cure diseases, but rather prescribe continuously full-page medications to block, mask, suppress, alter, emerging new diseases, again new drugs, unknown compounds studying in unknown population, unknown drugs again emerged with benefit-risk uncertainty ratio, again undergoing research by calling as updation, again unknown compounds. So this kind of doctors who prescribe this kind of drugs with aim to produce benefit-risk, no certainty about
and
the
they are
reversal
claiming
of
that
this.
they have reproducibility.
That is not.
That is not at all possible, because if the same drug is given to another population, different results will come.
Yeah.
Definitely different results will. They can give it to someone.
Benefit risk always there. No, whatever you give, there will be benefit.
If it was 70%, 30% benefit and risk, next time it will be 50%, 50%.
Right.
Sometimes risk will be more. So there is no guarantee that every time the same result will come. So there is no reproducibility. So where is the science?
Reproducibility of data doesn't make science. Science means there should be logics, there should be serious knowledge of cause, mechanism, effect, relationship meticulously explained. Here what you are doing, why you are doing, what is the objective, is it reversing the cause mechanisms of the disease? If you are able to explain only, it makes sense, and it is such kind of knowledge is called as science. Science is not data of, emerging data of trial and error. And 1 minute, I just want to interfere here. So, doctor is one who is attempting to reverse the disease, Mr. Abby Philip. That's why I am calling you like this. I'm sorry, but this is the fact for us. We have to follow the code of conduct of Ayurvedic science.
But
according to Ayurvedic science,
they have to be called as doctors. Whatever it is, in all these textbooks, it is mentioned as Parikshakaihi Pranitaha, Shishta Anumata, and Loka Anigraha Pravrittaha. It should be for the universal well-being. It is not for drug companies. So universal well-being is possible only by producing health. That is what is mentioned in our Shastra. So if somebody wants to become a doctor, or doctor in the real sense, Bishak, he needs to take BAMS, not BAMS, BAMS.
Bachelor of Ayurvedic Medicine and Surgery, and they should take training from SBABA, because existing education has lot of problems in Ayurveda colleges. There are lots of problems. In this matter, I agree with Mr. Abby Philip, but that is the problem which has to be attended by the concerned authorities. But parents and students who are interested to become doctors for the purpose of healing and not doing business. Their first priority should be, no doubt, BAMS, because BAMS is dealing with a science which explains the tool of logical reasoning in the science. So brilliant students must take up Ayurveda as priority, and they should simultaneously learn SBBA, science-based, evidence-based Ayurveda. They should undergo training side by side to become excellent bishops.